Let's bring in our good friend, Dr. Joe Congeni at Akron Children's Hospital. Joe, what do you got for us today?
Well,
by the way, successful week number 1. Oh, you were down on the Wadsworth sidelines last week?
I was on the Highland sidelines.
When's
we have the Highland camp.
Yeah, when's the last time you were at Arkwright Stadium?
It had been several years.
Yeah.
5 years.
They got it looking nice, don't they?
Really, really nice and a good, beautiful night. I love this time of year. And then Saturday I was at the Hoban game, so it got going. I'll be at Akron this Saturday, the University of Akron. Hopefully they'll have a good day.
What time are they kicking off?
Noon.
Oh, good.
Yeah.
Okay. All right, what do you have today?
So, a guy that everybody's kind of looking in at a little bit in the future of the Browns, everybody talking about the Browns, is Kareem Hunt, and it brings up that sports hernia. And this is the time of year. It's a hard diagnosis. It's not easy to make, and what is it and all that kind of stuff. The mechanism is in explosive cutting and twisting motions around the hip and groin injury, and a groin injury that just won't get better. Injuries most commonly soccer, hockey, football. You probably have noticed that Akron has some pretty good soccer players that come on campus. Many of them come with this chronic groin pain, and it's very common in soccer and hockey, this sports hernia. And we give it some time to quiet down with non-operative measures and physical therapy and other things. But when it's not getting better, they want to get it fixed. So the tough part about diagnosing it is if you haven't seen it a lot, people just have a real hard time diagnosing it. Can it be mixed up with an inguinal hernia? The old-fashioned hernia, the bulge and things that we saw in the old days? It can be, but if you know the difference, it's pretty straightforward. The hard diagnosis is hip injuries. So sometimes it is hard to differentiate between a labral tear of the hip or a structural arthritis or bony injury to the hip versus this soft tissue injury of the abs, the oblique muscles. Remember Nick Bosa last year, and everybody really kind of up in the air of shit. If you keep playing, it's just going to get worse, and it's hard to play through. Perfect timing for Kareem Hunt. Let's keep him in rehab over this period of time so he doesn't get in any trouble over that. So it will be about 4 to 6 weeks after he got surgery done. I love the word for surgery. It's called reinforcing or reattaching those oblique muscles of the abs or the groin muscles where the tear is, and it's an all soft tissue. It's not down into the hip at all. So kids are back really quick. They say 4 to 6 weeks here. I'm telling you that at Akron U Soccer, there have been kids back quicker than that after they have this surgery done, and they feel really good. Instead of feeling like that hip gives way every time they cut and pivot or kick the ball or run the ball in football, they feel really good and strong and stable in the abs down in that area. And so, gosh, here was the thing, 1990s, there wasn't even a thing in the textbooks. Nobody even knew what it was. Started to name it in the early 1990s, actually in Europe and England. And now it's one of those things that many teams have guys. You hear about it all the time. We could go on for 10 minutes and name guys, big name athletes. But in our high school kids, they get sports hernias too. And they just can't play at a very high level without getting this muscular surgery done.
Joe, and you bring that up, I noticed in baseball, kid for the Yankees that plays, his name's Luke Voigt, and he was diagnosed with a sports hernia. He opted not to have surgery, and he's back playing with the Yankees in about 4 to 5 weeks. My question is this: can it heal on its own?
It definitely can heal on its own.
Okay.
You get right to the core of the matter, right to the heart of it, Ray, as you always do. That's the big question. But you have to catch it early, and you have to take some time off. So how excited are these kids in week 2 of the season to be told, hey, take 2 or 3 weeks off and rehab your sports hernia? Not very excited about that. So Kareem Hunt had his chance there early in the year to run a little bit, and then we knew he was going to be off 8 weeks, so it was perfect for him. But if you catch these early, when we catch them early, and early on, it's hard to tell the difference between what we used to call a groin strain, and that may be what it is. But they get relatively rest, they rehab it, they do the basics of, stim treatments and strengthening treatments and soft tissue treatment, deep tissue treatments, and strengthening most importantly, and they do very well. If they try to play through it, they just keep re-aggravating it over and over and over again, and then they say, okay, enough is enough, fix it now. Do a lot of people
season?
Do a lot of people wait till the end of the season? Yes. Do a lot of kickers in the NFL are people that have sports hernias. Yeah, it can be a wasted season. It depends on where in that process, how functional, how well they're doing with it. Hunt looked terrible in the early preseason. He ran the ball a couple of times, wasn't really doing very well, being labeled a groin strain that wasn't getting better. Well, that is vernacular in the common term of sports medicine for probably a sports hernia, and no surprise when they go ahead and fix it now in somebody like him. He's got the time. But for somebody else early season like this, it's a hard pill to swallow to tell them, yeah, take 3 or 4 weeks off and we're going to operate on this thing, or take 3 or 4 weeks off and give it time to heal. So yes, if it's caught early, yes, we can get them to heal.
All right, Joe. Good stuff. Thanks for coming in.
Thanks, Ray. Have a great week.
You too. Dr. Joe Congeni, Sports Medicine Center, Akron Children's Hospital, joins us on Wednesdays on the Ray Horner Morning Show.